When it comes to mental health, a lot of focus has been placed on the normalizing the conversation. But what if that conversation is with your kid?
Yeah, well, in today's Family First, I sit down with a professional to find out how to get that discussion started, some warning signs that something might be wrong, and when it's time to seek the help of an expert. For parents, there's no shortage of things to worry about when it comes to our children. Are they sick? Are they hurt? How are they feeling? Some of these questions may be easier to get answers to than others.
Why is it easier to talk about, pains in our legs or pains in our ears or a toothache, but yet we can't really talk about like being sad and not feeling, safe at school or feeling, worried all the time.
Joelle Jones is a licensed clinical social worker at UPMC Children's Community Pediatrics in Camp Hill. She says the responsibility to make that conversation comfortable rests on parents. And the earlier you start, the better.
The younger they are, the less they're going to be even aware that, there is a societal difference between physical and mental illness.
Getting the discussion started with older kids can prove more difficult, which is why Jones stresses the importance of listening.
I think that the more casual that you're able to make it, and the more that you're showing that you're interested, that you're prepared to do active listening rather than, trying to change how they feel, the better.
Sometimes, no matter how approachable a parent is, a child might prefer talking to someone else, like an aunt, uncle, coach, or teacher.
It may be nothing you're doing as a parent, absolutely nothing, and you can't point to any reason why they're, just uncomfortable talking to you. That's okay. It's not something that you need to beat yourself up about at all.
Even if you're not the one they choose to talk to, there are a few things you should be on the lookout for.
If you see an impact to appetite, sleep, and if you see just a lot of behavioral change across environments, that's probably the best indicator that you need to consider whether or not something more might be going on.
And if you see something that concerns you, bring it to a professional.
Bring it to your pediatrician. Bring it to an outside source, an objective source, who can really use validated assessments, standardized assessments, to see if that is really outside the norm for their developmental stage.
Now, Jones says even a pediatrician can help answer questions and address concerns. They might even be able to catch something a parent misses, which is another reason why an annual checkup is so important.